Good morning, everyone. Thank you all for coming. I understand that there were some traffic issues, so we appreciate, Steve nodding head. We appreciate those of you who pushed through those, and we anticipate there probably are a few people still in the middle of those, so hopefully they get here safely soon. I think we've got one person on the line, but let's go ahead and get started, and we'll just go around the room and do our quick introductions as we usually do, if that's all right. So I'm Mindy Tueller, and I manage the Medical Home Portal, which we'll talk about briefly here as we always do. And then I facilitate this meeting for those of you who may not know, but probably everyone knows at this point. So Jill?
Hi, I'm Jill Connor. I'm from Shriners Hospitals for Children, and I'm the Physician Relations Manager here at the hospital. So my job is to help facilitate patient referrals, raise awareness about our services, and spread the good word, who we are and what we do.
My name is Gabi Baraguchi. I am a UPIC Quality Improvement Coach, and I'm working with Mindy on this UCCCN network meetings.
Hi, I'm Heather Carlson. I'm a nurse case manager. I work for Children's Special Health Care Needs in the Integrated Services, and I'm in the Ogden office primarily.
Walt Torres, Children's Special Health also. Work with Heather, social work here in South.
I'm Sarah, the coordinator there on
Hi, I'm Eric Christensen, Director of Special Health Care Needs Integrated Services, and I'm the program manager.
Lauren Thomas, and I work at pediatric as the medical home coordinator.
Hello, Tulsa from here at Shriners. I am a social work care manager, and I work mainly with our patients that come from Mexico, and I run our outreach clinic in El Paso.
I'm Chris Ferguson, and I'm the Director of Care Management here, outpatient services and outreach program.
I'm Rachel Glauser, nurse navigator, primary care.
I'm Isabel McCabe. I am with outreach for Primary Children's Hospital, so part of what I do is similar to Jill, which is to be a liaison and be a resource to the offices, and also to increase awareness for children.
I'm Jenna Doer, I'm the care coordinator at Wasatch Pediatric St. Mark's. My name is Keisha Wisuma. I'm one of the case managers over at the Comprehensive Care Clinic with University Top Peds and Intervention.
I'm Kim Bloom. I'm with UPIC as a quality improvement specialist working with staff.
I'm Tiffany Meyer. I'm a nurse care manager at Salt Lake Clinic, Minor Pediatrics.
I'm Adam Beach, and I'm a health advocate at Salt Lake Clinic Pediatrics.
I'm Margie Olson. I'm working at Utah Valley Pediatrics as the care coordinator.
We have Carly on the line. Carly, can you introduce yourself?
Yeah, I'm Carly White. I'm with the nurse care manager at Holiday Pediatrics.
Great, thank you.
And Kay.
I'm Kay.
Oh. Great. All right. So now I have to figure out how to advance the slides, Gabby. That might be a trick. I see no way to do that. So now, great. All right. So now we get to have our opportunity to do our brainstorming. So if, this is when we get to look at the Medical Home Portal and see if it can help us with resources, or see if we can add resources to it that you may be aware of and that we can share together at this point in the meeting. So if there are any barriers or hurdles or cases that you're struggling with, or questions that you have that you think folks in this group might be able to help you with, this is the time for that. So if any of you have something you want to put out there, please do. Anyone having some issues finding resources for their patients?
I guess I have one. It's difficult, so any thoughts or anything would be helpful. A 17-year-old, he's undocumented, single mom,
works 6 days a week from 5 a.m. to noon. She works really hard. She's a manager at Carl's Jr. He's in school at Van Loman High School. He's nonverbal. He's very aggressive. He has severe autism. It's hard working on medications with him. They can only afford, out of pocket, medications, and that kind of limits some of the medications that are used with him. They live in a trailer. They have no heat. They have no air conditioning. They have no resources. Mom started the immigration process for her older son, and that's about $1,200 per child. So they've done that for the older son, and she's trying to start that for Caesar, but it's another $1,200. Communication-wise, I've been trying to clarify with his counselor at high school if he's using an iPad or not. There is a Weber School Foundation that I can ask for an iPad, but communication is one of their biggest things. His frustration from being able to communicate with his mom and his brother in the trailer leads to really aggressive. He'll hit mom and strike her, and it's really difficult. The police have been called out before from neighbors, and that's been a horrible process as well. If she could help him communicate with her at home, that would be great. And like I said, I can try the Weber School Foundation for an iPad, but any other ideas that way. Also, in order to vent his frustration, he will throw objects in the trailer and hurt himself and hurt other people and destroy everything in the trailer. And so Mom is wondering if there's any avenue to try to get a room in the trailer padded for him so he can safely get his aggressions out and hit and do all of that. So it's hard. Respite care, anything like that, but I don't know if anyone has any thoughts or ideas for him.
So I was just looking in that area. So tell me again where they live.
They're in Ogden.
In Ogden, okay. So this is the Roads to Independence Service Center that says to advocacy for individuals, assistance obtaining and maintaining technology equipment, independent living skills training, information and referral. So it sounds like maybe if they couldn't directly help in some areas, perhaps they would be able to point to some things as well. I didn't see easily on their website what if they have an age range that they work with, but it doesn't sound like that they would have a restriction on that. So.
You might be okay for that.
That is really tough with the funding issues. So I remember, Gabby, the Layla Rose Foundation. Do you think this would be a case where they might?
That's a good question.
We do have a number of organizations in the Medical Home Portal directory that their purpose is to help with the funding part of situations, perhaps somewhat like these. So,
does it say if he needs to have a social for the Layla Rose? Do you know?
Let's look.
I mean, I can look later. Sorry.
Oh no, that's what this is for.
So he doesn't have one, right? Mm-mm.
What we do. Not a great deal of information.
That's okay. I can call them.
Call them.
Sure, I'll call them. I've never heard of it before, so that's great.
Yeah, this is one that we've had or heard of pretty good success.
Okay.
I don't think that they have a lot of requirements. So, yeah, and I'm not 100% sure where the funding comes from, but it seems like it's been a pretty reliable source in the past when our care coordinators have contacted them. So,
okay, that's great.
So Layla Rose, and then as far as, so it's undocumented.
It's a really hard situation with an amazing mom that I don't know how she gets through the day.
I'm thinking about the utilities. I know they've got they've got programs that should.
The Catholic Community Services they don't help with heat and utilities anymore, but you know, I've called 211 and talked with them about that. But they can help with the immigration process. Okay. Catholic Community Services can. It's just, you know, financially.
The Urban Crossroads House. I think it's Urban Crossroads.
Yeah.
It's right on 400 and 400 East and 500 East and 400 South.
Is it for Salt Lake area only?
So, I think, well, you gotta check that one out. But they are really helping with utility bills.
Okay.
They give vouchers.
Okay.
They know how to apply for assistance.
Okay.
The heat program and stuff like this. So.
Okay.
Yeah, and this is kind of interesting. I certainly wouldn't have thought about this. UtahRedCross.org. So in the eligibility information, it doesn't seem to indicate that there'd be any issues being undocumented. But I just want to understand a little bit more about that.
And they do, yeah, they have the heat programs for there.
Yeah. And then we'll just look quickly for Urban Crossroads.
Crossroads Urban Center.
Crossroads Urban, that's the one.
Okay.
Thank you.
Yeah. Kind of sounds like this situation.
Okay.
So it's definitely worth calling them.
Yeah.
They're very helpful.
If they will help in northern Utah.
They also give out food, so you can take care of it. So.
Great. Okay. And we'll compile all of these as well.
Okay. Thank you.
Okay. That's a tough one. And we had a few more people join us. Welcome. Sorry if you had trouble getting here with traffic and whatnot. So, anybody else have issues, difficulties they're encountering finding resources? Anything they want to bring up? Any new resources you've run into you want to share? Okay. All right. That's fine. Well, I think this will be a good set of links, and we'll continue to look through our directory.
There was one other one where there was a family from Davis County that we were struggling a little bit finding after-school activities for this kiddo. Okay. And so we ended up having them come to Ogden for the after-school activities, which is
not ideal.
Not ideal. So I just felt like maybe if we could look into the Davis County after-school resources, because I felt like there's just not anything there. So that's Ogden.
Right.
So I was really struggling when I looked at the Med Home portal that there was not really anything for Davis County. I think they might have the YMCA program, after school program, but I'm not sure.
So we have things listed here by city. So what you said there? Layton. Okay. So surf and swim.
You just have to pay to get in and take your kiddo
swimming facilities. Okay, well that's a good. So Kay, we'll do a little research into what there might be in that area.
Okay, that would be great. I think that a lot of families there struggle.
Okay. All right, so 8:50. Good. That means you have more time now. You can expound. Okay. All right. So we'll pull up. Let me get back to my slides to make sure I haven't overlooked anything. Welcome and introductions. Oh, and I was going to do a couple of little housekeeping things. We'll do that right now. So although we're at Shriners today, what I think we have decided going forward after this meeting is that we will continue to meet at the Utah Parent Center location. So for those of you who came last month, you know where it is, and for those of you who didn't or couldn't, it's in downtown Salt Lake, so it's not too far off the freeway, not too many downtown streets to cross. We feel like it would be a lot easier for most folks than getting up to the university on a school day. during the academic year. So 230 West 2nd South is the address for the Utah Parent Center. And there is a parking lot that requires a validation, but validations are covered and taken care of through the meeting. So, of course, more information will go out with every meeting. And we talked a little bit last time about having some sort of an opportunity to chat and network between meetings more easily and maybe get answers that way, and then also track those answers and be able to look at those again later to help with similar situations. We're continuing to work on that, and I hope to have something workable by next month for you. So more information forthcoming on that. And then Dawn was going to tell us something about an upcoming UPIC Learning Collaborative opportunity.
So we're starting a new learning collaborative on ADHD diagnosis and management. We're having a learning session November 13th. And I actually don't remember which clinic everyone is from, but I don't think any of yours are registered yet. I brought some of the flyers that Mindy has on the screen that I can give you, and with my contact information if you have more questions, you have something in your practices or would be interested in participating as well.
We did that. All right, so now I'll put Jill's slides up here, and we'll let her take it away.
Thanks, Mindy.
Yeah.
And for those of you who walked in a little bit late, I'll reintroduce myself. Again, my name is Jill Connor. I work here at the hospital. My role is Physician Relations Manager, Provider Relations. I help facilitate patient referrals to the hospital, raise awareness about our services, and let everyone in our community know who we are, what we do, and how to refer patients to us. So welcome to Shriners Hospital for Children. Show of hands, how many of you this is the first visit to the hospital? Okay, quite a few. Good. We will be having a tour of the facility, and I mentioned to Mindy we'll break up into 2 smaller groups. So if you have not toured the facility before, we would love to have you join us on the tour. Let's get over to this chair. Please feel free to interrupt me, stop me if you guys have any questions at any time throughout this presentation. I always like to begin my presentation talking about the wonderful organization that is behind all of our hospitals. And it's signified by this red fez. And I always like to ask people, how many of you know a Shriner personally or are familiar with a Shriner? Or one person. If you don't know a Shriner, maybe you may know a Mason. Does anybody know a Mason or familiar with Masonic fraternal organizations? So this is the driving force behind our hospital, the Shriners International Fraternal Organization. They fund, through a national endowment fund, our 22 hospital systems. And obviously, we also continue our funding through private donations, third-party fundraising efforts, and of course, insurance through our revenue cycle with insurance collection. So just to give you a background on the Shriners International Fraternal Organization, it's originated from Freemasonry. So every Shriner is a Mason. And I mentioned, you know, if you don't know a Shriner, you may know a Mason. And Masonic fraternal organizations date back hundreds of years. So basically, a couple guys in the late 1800s who were part of a Masonic fraternal organization in New York City decided they wanted to create a subgroup of the Masons that focused a little bit more on fun and fellowship. And later they added this philanthropic component to their organization. So Scottish Rite is another organization that's affiliated with the Masons. Their focus is on speech therapy. So that would be another tie into what you guys do with finding resources for kids. So again, fun, fellowship, and philanthropy. Today there are over 300,000 members across not only the United States, but also their largest growth now is through international growth. And you'll often see them participating in local events such as parades. They, you see them driving in their little cars, or they're often dressed up as clowns. So, but they do support a lot of community activities where they are at. Another thing to know about the Shriners, so in Salt Lake City, there is a Shrine Center on South Temple, this beautiful old building, has 2 sphinxes in front of it, and they're actually open for tours weekly. So, and it's a very interesting tour. You learn a lot of history about the Masons and the Shriners fraternal organization if you participate on those tours. But every Shrine member, as part of their monthly dues, goes into our National Endowment Fund to support our hospital efforts. And a lot of their growth right now, it used to be back in the day that all the major movers and shakers, a lot of major CEOs were involved in a Shriner fraternal organization. And now with the onset of social media, and we have social networking, it's become not as prevalent as far as their membership. Their membership numbers in the United States have shrunk a bit, but as I mentioned, their international growth continues to maintain itself. So this is kind of what spurred the hospital. You guys recognize this picture, circa 1920. This is an iron lung machine, and it was around that time that the Shriners wanted to get behind a philanthropic cause. And at this time, a lot of children were afflicted with polio. So in 1922, they started their first hospital. It was called Shriners Hospitals for Crippled Children in Shreveport, Louisiana. And their focus continues to be this threefold approach. Number one, to focus on high-quality care in the pediatric service areas that we provide. Number two is education. We work with a lot of, and where all of our hospital locations are, we work with a lot of educational institutions. Here we work with the University of Utah fellows and residents quite a bit. And number three is research. We conduct a lot of research in all of our hospital facilities. Also in this facility in particular, in our motion analysis lab, which is located downstairs, we conduct a lot of research out of that lab as well. And the beauty of the Shrine system is all of these services are provided regardless of a patient's ability to pay. This has always been the case and will always continue to be our mission. About 5 years ago, we entered into this revenue cycle where we are now billing and collecting for those services provided with kids who are covered by insurance. So that's not always the case. It took a downturn in the economy. Donations were down. We looked for an additional source of revenue, and at that time, 5 years ago, we didn't have any systems in place to bill for kids who were covered by insurance. We would still see those kids, and people would seek us out based on our orthopedic expertise, and we would never turn anybody away. And oftentimes, families would try to, say, is there any way you can bill, for insurance that we have? And that wasn't the case. And people always thought we were crazy for doing that. But so downturn in the economy, we looked for an additional source of revenue. It made sense. Let's put those systems in place, bill and collect what we can. So from a healthcare provider standpoint, I always tell providers, don't worry about insurance coverage. It's both ends of the spectrum. So from uninsured, undocumented kids, self-insured, Medicaid, all the way through great insurance coverage, we'll bill and collect what we can. And what happens when a child comes to us seeking our services, if they're not covered by insurance, we'll help them qualify for any plans that are available for them. If they are covered by insurance, we'll bill and collect what we can for the services that are provided. And if any fees are associated with their care that is not covered by insurance, so whether it's high deductibles, out-of-network expenses, if it is a financial hardship for the families at all, we will work with those families. And it's really a case-by-case basis. I had a care manager from a local pediatric clinic call me. Her son was born severely premature. He's now 14, but has had multiple orthopedic issues his entire life, as well as other medical issues. And on paper, the family looks great. Dual income family. You just never know what goes on behind the scenes. But behind the scenes, they had, a stack of medical bills and payment plans. So her concern in coming to us, was what kind of payment plans do you guys offer? we don't have payment plans. Again, it's a case-by-case basis, and it really comes down to the family, relaying that it is a financial hardship for them to pay for those services. So it's a really beautiful model that the Shriners Hospital System operates on. This looks like our hospital system today. So we started with that one hospital in 1922. We've now branched out to 22 hospitals throughout North America, including one in Mexico and one in Canada. You can see the one on the left here. We have a hospital in Honolulu as well. Our primary focus continues to be orthopedic care. When polio was eradicated, we found that niche to providing pediatric orthopedic care was very needed. So we continue that. We also have 4 hospitals who incorporate burn care, pediatric burn care, and those are notated by the orange markers there. We also have a handful that include spinal cord rehabilitation services, and then also a few who provide cleft lip and palate repair. The nice thing about the Shrine system is that when we do have families who are in need of additional resources, the Salt Lake City Hospital primarily and only focuses on pediatric orthopedic care. So we don't provide these other service lines. But if we do have families who are in need of those other service lines, we can refer to our sister hospitals and have them seek treatment there. Another way that the Shriner members themselves give back to the hospital is via transportation funding. So we never want proximity to our hospitals to be a deterrent to providing care for those families. And it could be something as simple as a family traveling from Ogden who may be in need of gas reimbursement funds. It could be somebody who doesn't have means for transportation and they need shuttle services. So those can be arranged. When the appointment is made, the our intake coordinator will always ask the families if they require assistance with travel. So I always like to emphasize that when I'm talking to providers. This is where we are at today. Our Salt Lake facility, we've had a presence in Salt Lake since 1925. We originally occupied a wing in what is now the St. Mark's Hospital, moved to this location. This facility was remodeled in 1995, and our catchment area is quite large, pulling from all of our surrounding states. If we back up to this map, you can see there's not a lot of Shrine hospitals around the Salt Lake City area, so we do bring patients in from all of our surrounding states, including northern Mexico. We have about 5,000 active patients each year. 70% of those come from Utah, about 1,500 inpatient admissions, 15,000 outpatient visits, and about half, and it's now over half of our referrals come from healthcare providers. So families can always self-refer to the hospital, but typically if the call is generated from a healthcare provider, we try to get priority scheduling for those families. In addition to celebrating our 90th year, our 90th birthday this year, we also received this great ranking in conjunction with Primary Children's. And we were ranked number 10 in U.S. News and World Reports for best hospitals in orthopedic care. So that's something that we're very proud of and that we'll be promoting to the community this year and next. And again, when I talk about our collaboration, and the university, or excuse me, the pediatric orthopedic providers that are here in Utah, it is a unique collaboration that we have, not only with our surgeons here, but also Primary Children's Hospital and the University of Utah Department of Orthopedics. So in your bags, your goodie bags, you do have a folder that has a bunch of our handouts, more specific detailed information on the hospital. This slide showcases our medical staff, and in your packets you have more detailed information on who each of these medical staff members are and a brief bio about them. Dr. Kristen Carroll at the top here, she is our Chief of Staff. We have 5 full-time orthopedic surgeons on staff. I often get the question, oh, there's a misconception that people think, all of our care here is run on a volunteer basis, and that is not the case. All of our staff and employees are employed by the Shrine Hospital System. So we have 5 full-time orthopedic surgeons on staff. We also draw from the University of Utah Department of Orthopaedics and in conjunction with Primary Children's 7 other orthopedic providers as well. We have mid-levels on staff, pediatric neurologists, anesthesiologists. We have 2 plastic surgeons on staff as well. So we have a nice quiver of pediatric orthopedic providers. And again, this is due to our heightened connection with the University of Utah Department of Orthopedics and Primary Children's. All of our 5 orthopedic surgeons are on faculty at the U, and as you know, all of the pediatric orthopedic providers at Primary Children's are contracted via the University of Utah as well. So any questions on that? I'm going to go through just a short list of some of our inpatient surgeries and other procedures that are done at the hospital. Another misconception about the Shrine system is people often think of Shriners and they think of wheelchairs, severe disabilities, and absolutely we care for those kids. But I like to remind people we treat every orthopedic condition, you know, the bread and butter basic conditions, mild to severe. So also in your packets, there's a handout here on basic positional correction. So it could be something as minor as in-toeing, flat feet, bowed legs, knocked knees, something where the pediatricians may tell the families, you know, let's wait and see. It's most likely your child will grow out of that condition. Oftentimes the parents want a second opinion on that, or maybe the pediatricians or primary care providers would like a second opinion on that, and we can be that second opinion. We also provide non-emergent fracture repair. We don't have an ER facility at this location. However, as long as the child has been seen and stabilized, we run outpatient clinic here Monday through Friday, and we typically can squeeze those fracture kids in between our regularly scheduled patients. So from same day to about 3 days out, we can get those kids scheduled. Also, you know, non-emergent fracture repair, sports injuries. We do a lot of scoliosis and spinal care all the way through severe spinal fusion issues. So really anything bone and joint related. The only prerequisite for care is that the child is 18 and under with a treatable orthopedic condition. And now, if the child is in our care on their 18th birthday, we will continue to treat them through age 21 as long as it is medically feasible to continue to do so. And, you know, that's due in part to it's often hard to find that transition to adult care. So as long as it's medically feasible, we will continue to treat those kids. So I mentioned scoliosis. EDS casting refers to elongation, derotation, and flexion casting, and that's a serial casting method that's used to treat infantile scoliosis. That's a very specialized procedure that we do here at the hospital. We run a club foot clinic. That is also run in conjunction with the University of Utah and Primary Children's. In your you'll see this flyer that we just sent out advertising our club foot services, and that has been run here at the hospital weekly. It's on Thursdays here, and we also offer that clinic on Monday at Primary Children's Riverton. And that is staffed by one of our surgeons and a surgeon from the University of Utah Department of Orthopaedics. Amputation, limb length discrepancies, hip dysplasia, hand issues, osteogenesis imperfecta, cerebral palsy, and again, this is just a short list. I often tell providers, you know, if you're not certain if we treat a certain orthopedic condition, just call us and let us know. If we don't, we will refer you elsewhere. The other beauty of the Shrine Hospital is that all of our services are provided at our facility. So it's a one-stop shop, if you will. We have our own in-house wheelchair and seating department. This is a very busy department. Last year we had about 600 chairs that were either refurbished or new chairs constructed for kids. They incorporate a unique pressure mapping system with custom air-filled chambers to help alleviate any symptoms associated with long-term wheelchair use. Also at our facility, I mentioned our state-of-the-art motion analysis lab. This is a great lab that, again, conducts a lot of research out of this lab for both pre-surgical and post-surgical studies. So again, That's something that I'll often tell providers or parents. If they recognize a child who has a basic gait issue, oftentimes there's an underlying orthopedic condition associated with that. So we can make a referral to our clinic and they can be seen in the gait lab downstairs. We have our own in-house therapy services department, which includes physical therapy, occupational therapy, speech therapy, which is often a big hot button, and I will note that our speech therapy services right now are reserved for our patients who are in our care for orthopedic conditions, and a recreation therapy department as well. Other services include specialty clinics. We have a muscular clinic, a cerebral palsy clinic. I mentioned our clubfoot clinics, osteogenesis imperfecta clinic, which Chris talked a little bit about with some of you this morning. Hand clinics. A new clinic is a skeletal dysplasia clinic for us, and also Cornelia de Lange syndrome clinic is new as well. Also on site, we have our own in-house orthotics and prosthetics department. Again, a very busy department, and you'll see that as part of the tour. That's one of the fun places to stop on our tour. We have our own child life department. Chris Ferguson and Alyssa are here from our care management department. We have our own in-house radiology, and you'll see the little EOS machine on the side. This is really exciting for us. We recently received funding for the state-of-the-art EOS digital imaging machine. It'll be the first of its kind in the Intermountain West when it arrives this fall. It allows 3D images. The children can get in the unit standing upright, so it's really great for any, full body scans, especially with a lot of the scoliosis treatment that we do here. And it also has 90% less radiation exposure for those kids, which, a lot of these kids with orthopedic issues go through numbers and numbers of radiology examinations. So anything that we can do to decrease our radiation exposure is great. So we're very excited about that. And that also goes to show you this was done through a private donation funding from a foundation, a local foundation. So we were really excited to receive that funding. We also have our own in-house nutrition services, and then we also have 4 patient and family housing units here at the hospital. So, I mentioned our large catchment area. Oftentimes we have families who are coming in from out of state and also internationally from Mexico and beyond. And so we have those family housing units available. We also work with our local Ronald McDonald House for family housing, and then we also have negotiations set up with local hotels to provide discounted housing for families who are traveling a great distance. Other ways that the Shriner members support our hospitals, in addition to their volunteer services and their financial funding of the hospital, they also support us through local screening clinics. To give you an idea, I mentioned we have our Shrine Center that's in Salt Lake, but there's also Shrine Centers and Shrine Clubs throughout Utah. So there's one in Ogden, there's one in Provo, there's one in St. George. So they're all spread out, and the Shriners like to support the hospital by helping to identify patients in need of orthopedic care. So they'll set up screening clinics multiple times a year. It'll be staffed by our care management department as well to help identify those kids who may be in need of orthopedic care. And again, these are usually set up in the more rural areas of the state and surrounding states. We also run outreach clinics, and Alyssa mentioned her outreach assistance that she does in working with patients in northern Mexico. She helps run our El Paso clinic. We used to run outreach clinics in Juarez multiple times each year, and it just got to be too violent there. So that's when we decided to set up our clinic in El Paso. And unfortunately, it was at the time, you can correct me if I'm not wrong, Alyssa, but right when they were starting to tighten down on immigration laws. It used to be very easy to get kids our way, basically a letter stating that they needed care from us, and very little questions were asked with Immigration and Border Patrol. And now it's a bit more of a process to get kids through here, but we're working hard on making that happen. So this is how we get into our surrounding states as well with these outreach clinics in Denver, El Paso, and Phoenix also. So now down to the nitty-gritty as far as patient referrals. Again, you know, I touched on those things. Very easy to get referrals to us. You know, another misconception about the Shrine is that it's hard to get patients our way. And it used to be a lengthy application and referral process where you had to know a Shriner member to get into the system. That application has been done away with. You no longer have to have a referral from a Shriner, so it's simply a phone call. And again, families can self-refer. You guys can make the call. Providers can make the call as long as they have a treatable orthopedic condition. All insurance and Medicaid plans, again, both ends of the spectrum, and identifying patients, you know, from mild to severe orthopedic issues, patients in need of surgeries, wheelchairs, motion analysis studies, prosthetics or orthotics. We have a toll-free referral line, and that is also in your packets. There's a pass-along card with our referral line. We also have pediatric orthopedic referral guidelines that are on our hospital website as well, and also that patient referral form is on the website as well. So with that was a lot of information. Do you guys have any questions about anything that I've covered? Yes.
So if you have someone that has a fracture, we can send them, do we call this number?
Yes.
And then we can make it.
Yes, as long as they've been seen and stabilized. You know, they can't come right off the playground or, you know, because we don't have an ER. But as long as they've been seen and stabilized, yes, you can make that call. Or the families can call as well. Yes.
There, for your in-house wheelchair, are you provide it for someone outside, like your children that is looking for something for a kid to go home, and they can't find it in the community? Is that
typically, yeah, Chris, they need to be seen in clinics first and then referred to the wheelchair and seating department.
A child who's going home from surgery, you know, we don't do that at all. So, I mean, we use their insurance and we set it up just like you do in terms of doing our discharge planning and setting wheelchairs up. And we have a few loaner wheelchairs that we can sometimes provide to families that they have no insurance that are our patients going home. That's very, our seating program is really for
I have a question.
Yeah.
Too, I think. I was told that they need to be seen by a physician here to get orders for equipment like wheelchairs and standard gait trainers. Is that true?
They have to be our patients.
Okay, so they need to come here for
We offer
all of that.
Yeah, we offer the new EOS machine, the radiology, which is going to be a big thing, and our gait lab, and our prosthetics department, and our seating program, and our physical therapy, all of those programs, but you have to be seen and be a patient here as well. And you can still be a patient other places, but you have to be right. You have to be seen here, have an orthopedic issue, be seen by our doctor who writes the order, and then you can do ongoing physical therapy. And the same rules apply. That if you don't have insurance or you can't afford it, or we really work with families very closely and doing kind of waiver programs with them and helping them apply for better care. And so we do see them, and we are able to do that. And if their 10 visits run out, we can continue to see them. So we have, it's a little bit easier than just out in the community, but they have to be a patient.
Yeah.
What about insurance? I would assume you take a whole bunch of different types of insurance. Are there any that just flat out won't work for you or no?
Pretty much Select Health.
And that's not to say that we don't see Select Health patients. They are our largest patient population that we see. So again, it comes down to, we will collect what we can from what their insurance provider is willing to pay us. So we'll try to get it, as much as we can, but we never And I guess when I'm out talking to providers, I never highlight what insurance system, we're on, because let us worry about that. Just send the patient our way. Again, both ends of the spectrum. If there's any fees, if they do end up becoming an out-of-network patient, and there are fees associated with their care that, it is a financial hardship for them to cover, we will work with them. So, yeah. Anything else?
No exceptions on the age, right?
Just 18 and under, and again, if they're in our care on their 18th birthday, we will continue to treat them through age 21. But I also mentioned, undocumented patients as well. So.
Wow, I think it was pretty astounding. I learned a lot, and I thought I knew already. Great. Thank you so much, Jill. So I think what we do, if it's all right, is rather than going on the tour and coming back here to wrap up, I think you're very welcome to leave your purses or anything else that you may have brought while the tour goes on. But at the end of it, it will simply be grab your stuff and go. So I'll do a couple of little wrap-up things, but if it's all right, Jill, if we have a minute or so, Gina has something that she'd like to mention that I think is timely and important. Do you want to take a second?
So I don't know if you have seen the information come out that there's a new Medicaid waiver for medically complex. The timing is critical. I will send out the information with Mindy. The open enrollment will be October 1st through the end of October. The tricky part is on the application, it says that children have to have a SSI disability determination. I encourage you to tell your families if they have complex medical conditions, which they are seen by more than 3 specialists, have 3 or more organs affected, to have them apply regardless, and then they can work through getting that disability determination. It's going to be tricky on the state because we had been told originally that we could push through with Social Security Administration. I've gone all the way to the top. They said no, if their income is way over, they don't have the manpower to get these disability determinations done for us. So it will fall back on the state medical review board. But that's on Medicaid. So I just don't want families to feel like, because it's going to be a little bit of work on the family's part getting all of their medical information, getting that disability determination, but to have them apply regardless in October so that, and let the nurses determine, how far to go, because I think there's a lot of misconception out there right now. Families are telling other families, oh, your child isn't severe enough or significant enough. It's like, let the professionals determine that. So one caution I would say is don't send somebody there that has solely behavior issues, because this is really meant for those kids that the families are drowning in medical debt, and they are very complex kids. So unfortunately, there's only going to be 167 slots. And this waiver does go up till the age of 18, unlike our other waivers in the state that are kind of worked to death. But the thought there is that at 18 that they can qualify for Medicaid on their own and hopefully have some turnover. And we're really hoping with the advocacy organizations to go back and get the 500 slots that we originally thought we were getting, but there was a mess up with the fiscal analyst in the last minutes of the legislature. So I'll send out the information, hoping to get some information to definitely to South Main and Midtown in Spanish, because I'm really afraid we have all these listservs, all these great newsletters that some families are on, but the ones that may really need it aren't on any of these places. And so trying to get out to those families that English is their second language or Spanish is their only language, and definitely the underserved population. So send that out with all of them. And then if you have any questions, you can call me. I'm on the planning and work group with Medicaid in trying to help get as many families that are qualified for it.
Great. Oh,
Thank
good.
you.
Okay, so I want to encourage you to get some food now, if you haven't already, or if you're still hungry, because I don't know what's exactly going to happen to that when we go on the set.
Well, it's going to go away, so you should eat it.
Yeah. Yeah, especially for some of you who came in a little bit late and didn't grab it. So please, it's delicious. Oh my gosh. And while you're doing that, I'll just do my little wrap-up speech. And so because Gina is such a valuable font of information, we actually have a few more things that she came up with about Heather's case that we'll add to the notes that go out for the resources of the month. So she mentioned that Davis behavioral might help with this boy with severe autism. It can't hurt to ask. And she mentioned Holy Cross Ministries, and she mentioned some of these prescription assistance organizations. So we'll look at all of those and compile those and send those out. And so I won't show you the slides. There's no point in showing you the slides again, but I'll just tell you for our wrap-up. Do you remember the information we sent out about the Utah AAP chapter's upcoming free conference about toxic stress and trauma? So I understand that they have 150 people who have signed up to go, and they have 140 spaces, but they're still encouraging you to go if you'd like. We'll find room. So it sounds like it's going to be a pretty cool day. It is October 6th. Chuck is speaking. Dr. Rowan will be speaking. And the medical home portal will be presenting too. And then don't forget about the ADHD Learning Collaborative that we begin on the 13th of November. Information will go out about how to sign up for that if your practice is interested. Our next meeting is October 21st, and that's the typical third Wednesday of October at the Utah Parent Center. And watch for our resources of the month email, come out in a couple of days, and we'll include the link to the YouTube channel where the recordings are archived of these meetings. So with that,
Heather asked a question, and it's one that comes up quite often. Even if a child is already on Medicaid, encourage them still to sign up for this waiver, because as of right now, there's 3 to 4 hours a week of respite that is on this particular waiver. And if they already have insurance, great. Still encourage them to sign up, because that actually only helps Medicaid if they have a first and then have the Medicaid to be the wraparound. So thanks, Heather.
Great. All right. We're ready. She's here, our other tour guide. So we're splitting up into 2 groups today to make it more manageable. But before we break off, just to let you guys know, in your folders is my business card with my contact information. Please feel free to reach out to me at any time. If you guys would like to schedule additional meetings or tours for your physician groups or your organizations that you represent, I'm happy to do that. If you would like additional materials, for example, we have a hospital fact sheet in there that gives information to patients and families once they've been referred to our facility. These are both in English and Spanish, and I can get additional supplies of these for you. So anything that you need, feel free to email or call me, and I'll do the best I can to help you guys out. Great. So thank you. All right. So groups of 2. If you want to just split down the middle.
So yes, so I think 2 groups. You're going with 1.
Yes, I'm going with 1.
Okay, so very good. So yeah, if you don't mind, we'll just take this half and then go.